All right, so welcome. We're just gonna review how to set up the Atrium chest tube dry suction. This is the main chest drainage system that you'll see here at the hospital. If this goes on back order, we are going to upload another video about using the Pleurovac system, which is also a chest drainage system. With the Oasis, it is dry suction, so setup is minimal. It should come with a little vial of water on the back. Mine is missing, but we can just pretend that it's here. The water vial does contain sterile water, and it's about 45 mLs of water. You would just take that water and you're gonna pour it right here in the top. There's a blue port of the chest drainage system. You're gonna empty the entire sterile water bullet into this chest drainage system, and it should fill to this arrow here. And this column C is our air leak chamber. So really, we're just really honestly looking to fill the air leak chamber with the water. That's the only thing we have to worry about. Once that is filled, we want to look at the provider's order and see what they want the suction set at. As dry suction, we have a dial on this chest drainage system to control the amount of suction applied to the patient. Here you can see the orange indicator, and there is a dial here to the right of your chest drainage system. So I can actually dial to the correct ordered amount. So let's say the provider orders this to be set at the -20 mark. I would just set my dial there, and then that part is set up. The next thing I'd want to do is get my suction equipment set up to the wall. Unfortunately, I don't have the wall regulator here with me today, but what I would want to do is I hook up suction tubing to this blue port. Once I filled it with water, a one-way valve comes on, so I won't be taking that water back out with the suction. But I put my tubing here, and then I connect it to my wall suction. Here is the suction that's connected then to my patient. You can see there's a clamp. We don't clamp this ever unless it's ordered by the provider to be clamped. If the patient's being transported, you could just disconnect the patient from the wall suction, but please don't clamp this ever unless the provider orders it clamped. The next thing we want to do is make sure, have the patient take a deep breath or cough. This area B or column B is our titling column, our water seal. So every chest drainage system has a water seal. You want to make sure if they're taking a deep breath or coughing that this water level is coming up and going back down. That's just normal titling of the lung. If you notice that the water level ever gets stuck after the patient exhales or they're done with their coughing spell, it means there's a higher pressure in the chest drainage system. We need to lower that pressure. So on the back of your system here is a little button. You just want to press that in. It will not affect the patient, but it just lowers the pressure in the chest drainage system. So give that a quick press in, and you should note that your water seal chamber, the water level has returned down to normal. Always take a look at that air leaked area C, and make sure if you notice any bubbling. So if you notice continuous bubbling, that means that there's an air leak. With the dry suction, it should not be continuously bubbling. It's a more quieter system than what we were previously using, the Atrium Oasis. You did see a normal bubbling with that. The only time there should be bubbling here is if there's an air leak. This area E is our bellows. So if we have this hooked up to wall suction, there's a little orange ball in here. The bellows will actually come out to the triangle to let you know that suction is properly applied to the patient. If you just have this set to water seal, meaning it's not connected to the wall suction, you see the chest drainage system just as it is, you will not see this bellows moved. But once you do hook it up to the wall suction and the regulator on the wall, you will note usually between like 60 and 80 centimeters of pressure, the bellows should come out to the triangle, and you just know that suction is properly applied to the patient. If your unit ever gets knocked over and the drainage levels get skewed, you need to change the system. So in order to do that, you want to get your second system set completely up, and then it's up to you. And I always say grab a partner, because if you clamp this to change it, you might forget to unclamp it. So grab whoever is near you. So instead of clamping it, you can have your friends clamp it with their hands. And then what you're gonna do is take this port, you press this clear button right in, and then it disconnects. And then hook the patient up to the new unit very quickly. And then you hear a click and you can unkink the tubing. And then you have your new chest drainage system set up. It's also important, if you ever notice that this air leak chamber, the water level's decreasing from that blue triangle, there's an area on the back to inject some sterile water with a blunt tip needle. You always want to try to keep it at the correct water level to be accurate for checking for air leaks. If you have any questions, you can let us know.